What I'd like to start with is I'd like the panelists to sort of introduce themselves and what is their real focus. We'll go around the table and then we'll start with what their experiences have been. And the whole idea of the panel then becomes is what are the learnings we can really take forward. One of the things which happens again in the Indian healthcare sector, a lot of hospitals have a lot of strong protocols, but these are only limited to that area.
Indian Healthcare Life Sciences Sector Focused Fund is actually sponsored by the Piramal Group, the Ajay Piramal Group. And what we're looking at as part of this fund, we're actually looking across the entire healthcare life sciences space, whether it's hospitals or nursing homes or specialty clinics, wellness chains, or pharma, biotech companies, or even the enabling business models that Dr. Mehta talked about, like healthcare IT companies, medical device companies, retail pharmacies, we're looking at clinical research, CROs. So we're looking at anything to do with healthcare life sciences is what our focus is. We have, it's a very recent fund. We started making investments. We recently invested into a hospital in Tamil Nadu, and I guess we'll talk more about that. I guess depending on the kind of questions that get asked. So that's my background. But in terms of my own personal background, I actually come from the healthcare life sciences background. I spent a lot of my time in the US working with IBM Consulting, focusing the US healthcare life sciences business. Worked with very large hospitals in the US like Cleveland Clinic, Mayo Clinic, and various other CROs like Quintiles, Blue Cross Blue Shield insurance companies. So my background is more from the consulting and the industry background within the healthcare life sciences space.
Yeah, hi. Good afternoon. My name is Satish. I work for DFJ, Draper Fisher Jurvetson, a venture capital fund. We manage around $6 billion, have presence across the globe. We made several healthcare investments, whether it is in the devices space or pharma or kind of quick healthcare services kind of space in US and China. We're yet to make any healthcare investment in India, but actively looking at opportunities within India, and I can elaborate more during our Q&A or interaction.
Hi, my name is Monica Shah. I'm with Acumen Fund here in Hyderabad. Acumen Fund is a little bit of a non-traditional venture capital fund. We're a non-profit social venture fund. We make investments in businesses that bring healthcare, water, housing, and energy to low-income consumers. We have offices in India, Pakistan, and East Africa, as well as in New York. And I work in healthcare for Acumen, so healthcare makes up about half of our portfolio in India, as well as globally. Because that's a little bit of a unique concept, I'll talk about one of our investees in particular. So we've made investments in a number of low-cost hospitals. So Life Spring Hospital is an investee of ours here in Hyderabad. It's a low-cost maternity care hospital. They've used a number of kind of innovative financing, build, and technology innovations so that the cost of one Life Spring hospital is actually $100,000, as opposed to, that might be the cost of a bed, right, in Apollo or Max Care. But we're looking again at a number of investments. Our interest in technology is largely around low-cost innovation. So how can technology be used to expand access to high-quality, affordable healthcare?
Hello, I'm Dr. Yashwant from Innocent Advisory Services. We are a private equity fund focused on healthcare. We also invest in the complete spectrum of healthcare, starting from pharma, CRO, medical devices, healthcare chains, and clinical research. And we've already made three investments. We are a $90 million fund based out of Hyderabad. Because it's a healthcare-focused fund, the team consists of people who've been in the healthcare industry for a long time, and the expertise has been built up within the team, which helps us add value to our client companies.
Thank you. I think we'll begin with Monica and about the low-cost model and their investment in this particular thing. I think the prices are absolutely stunning because $100,000 today, I don't even think Apollo could put up one bed because most of the tertiary care hospitals are at about $250,000. And just to compare with it, in the US it's about $2 million per bed. So probably you could put up 2 hospitals where they put up 1 bed. And I think that's going to change the paradigm. So if you can just elaborate about this low-cost model and more, what have been the challenges actually replicating and taking it forward?
Sure. So LifeSpring Hospital, as I mentioned, is a maternity care hospital. So far, they're in Andhra Pradesh. They've just opened their 8th hospital, and they'll have 9 in the next month. Some of the low-cost innovations that they've used are really it's largely just around the build of the hospital. So, Ron, I think you rightly mentioned real estate costs and build out is a huge barrier. So LifeSpring actually rents existing buildings, converts it to a hospital to suit their needs, and these buildings are not purchased. The land is not purchased, so they operate on a lease structure. Other innovations are, there's really a number. A lot of it is really just around just being tight on cost, being tight on inventory. There are doctors, they have some in-house doctors and some consultant doctors and whatnot. In terms of, I think you asked about the challenges in scaling. So I think you rightly pointed to the need for, I forget what you call it, but right, so exactly, so the need for paramedical and clinical nurses, right, but I was thinking more about the challenge of once you open a new hospital, right, so I see that a lot. When you speak with a doctor who has an existing hospital in tier 2 or tier 3 town, and he's looking at opening a new hospital, he's maybe had that hospital for 10 years. That challenge of when you open a new hospital, how do you get patients to come in your doors quickly enough that you reach break even in the time frame you need? It's been really an interesting challenge for LifeSpring. So when you think about maternity care, women typically decide where they're going to have their baby 3 to 6 months into their pregnancy. So if you think about starting, marketing and advertising from day one of opening a new hospital for LifeSpring, which is initially, they really work much farther than that. They realize that they actually need to be sending their marketing team out 6 months in advance, going door to door, speaking with women. Because of our consumer base is really women earning about $2 to $6 a day. They meet with a lot of microfinance groups and self-help groups to really start getting the word out there. Another challenge is just that LifeSpring considers, and I think for many hospitals, your advantage is really around your customer, right? So LifeSpring is a very customer-centric model. They consider their culture one of their core assets. So replicating that as they plan to scale quickly, and figuring out how to do that, whereas many hospitals in India have both consultant doctors and in-house doctors. So especially replicating that with doctors who maybe only work with you for 2 or 3 days a week has been a core challenge.
I think you covered most points. One of the things which worries me is, often low cost is associated with low quality, in India. Not only in India, but classically, healthcare doesn't have the classical laws of economics. Because people can't really judge healthcare. So like if you went in for a surgery, you're anyway unconscious when the surgery is being done. So there's no way you can actually judge what's the quality of surgery. So you judge it more by, how does the wall look when you come back? How does rather the ceiling look, because that's what you can see. How the other aspects, how did the nurse treat you? So also what's typically happened is, if you reduce costs in healthcare, and it really sometimes does not increase volumes, because people feel that, either you were overcharging them or you've cut quality. So how do you address this?
Those are a lot of great questions. So, a few things. So one is to start with your question about sort of customer perception. I agree that's critically important. So LifeSpring Hospital, it's low cost, but I think if you look at a room like this, right? So you judge it based on many things. So we have fancy silver walls and nice wood paneling and whatnot. But that probably doesn't matter that much to us, right? So what you're really looking at is cleanliness, Is the system well organized? Were you received, you were received at the front desk and you received a nice plastic badge? Sessions are publicized well in the brochure. So I think LifeSpring is really focused on providing high touch, a high touch system. So when you walk into a LifeSpring hospital, you're received by a greeter who immediately asks why you're there that day, if you've ever come before. They've actually invested pretty heavily in a CRM system, so customer relationship management system. So when you come, they know almost instantaneously, where are you in your pregnancy again? Is it your first time for visit? Who did you see before? And what are you here to do today? So I think the answer is both in terms of being lean on cost, but making sure that the hospital is clean and presentable, and also in terms of really, I think I would say the most important thing is around process and organization, and as well how kind are the nurses, how are you treated by your doctor.
So that's very interesting. The other thing in reducing costs, I think one of the areas again is actually technology. And technology, if you look at healthcare, it's still a cottage industry in the healthcare sector. Though healthcare is a very data-driven, everything we do is data-driven. But less of this data is actually captured and very little is made use of. So now I'll ask Manish to actually take us through and say that how technology can really help build this low-cost model.
So I think a few perspectives, and I don't take too much time. So the technology can be addressing, if you divide technology into compartments, one is the public healthcare space, where it can really immensely benefit by the mass technology, channels, mobile and portals and stuff like that. I've been meeting people who have been talking about healthcare delivery through things like Facebook and Twitter. I mean, these kind of things are in the ideation phase right now. If you look at the other compartment, which is the tertiary and the secondary model, their technology, again, the important thing is, as Monica was saying, high-touch model. So you cannot have what is called as a remote technology-based thing. That's been a very big challenge in the secondary and tertiary space, that remote technology-based healthcare delivery is not working out. So there, I think in these hospitals, the technology, the important piece is CRM, the hospital systems that they drive inside, and the medical device interfaces and stuff like that. So that's the hardcore technology that can really drive, costs down, and it can really have that patient centricity in these hospitals. And the third compartment would be the peripheral services, whether it's the pharmacies, the CROs, and the other supporting services around hospitals. And I think there we need more technology interventions today. I mean, I see a lot of boutique startups which are doing technology solutions for peripheral services, but there's no focus around that area. So, I think that
I think technology would play a greater role, and I think it's sort of very neglected in healthcare. And I think being a doctor, I think doctors are more to blame, because whenever I try to do it, I mean, the greatest resistance, unfortunately, comes from the doctors. But having said that, I think there's now a paradigm shift in the new generation of doctors, and it's led by two things. It's led by the first thing, imperative, I think, is the clinical skill sets of the doctors are not this good. They did a study at Harvard, which is, the Harvard Medical College, probably supposed to get some of the best doctors. And many of the doctors are not even able to differentiate between the first and the second heart sound. So that is where the clinical skill sets have gone down. So, I think they need to look at technology, and that'll be more acceptable for them.
At a recent similar meet like this, two sort of chairmen of multi-specialty large hospital chain, and you were there, Anna. They were old guys, 50 plus, and one of them made a comment to other that, we are a sunset guys. The new breed that is coming in, the new doctors are coming in, they cannot live without technology. So, but they may have meant computers and HIs, but generally speaking, the new breed is taking over. That's what they made as a comment.
So we have this evolution of healthcare in a sense. Healthcare was an art, became a science. Now I think it's becoming an industry. Yeah.
So let me add to that. I think in US, a couple of our most successful investments, eHealth is kind of a hospital information system, in ERP for hospitals. And Hippocrates is a mobile, kind of information system for doctors so that they get the records, from repositories in real time, to be able to make decisions. But on the other hand, let me kind of state my experience in India. Very recent, one of the most probably the prominent hospital chains, you get this annual health checkups. They do talk about opening a record for you and then maintaining that record over a period of time. Then I went back to the same hospital. I was hospitalized, got some IV and got an ultrasound done. They couldn't correlate. I mean, during your annual checkup, they still do your ultrasound. And, and I asked the reason. I said, did the doctor get my previous ultrasound as well, when he got the new ultrasound? They said, no, they didn't get. Why? Because you were an outpatient then, but now you are an inpatient. So none of the departments inside the hospital, so there's not just the technology itself. I mean, technology could be applied, bought, implemented. I think it's the change management and the mindset of people, to be able to use the technology, which is very important. And I'm not saying, health technologies adoption, the healthcare industry has been a laggard, everywhere in the world, including US.
I totally agree with Sati. In fact, they say even in the US, 30% of the tests are actually repeated because no one could trace where the previous results were. So we go back to actually Satish. They've been a large fund, as he mentioned. They've done a lot of investments outside India, and these have been fairly large investments. But they're still waiting on the sidelines for the Indian investment. So how do you see the Indian scenario, and what do you see are the greatest opportunities, and maybe what are the challenges which you'll encounter here?
Yeah, just to give you a flavor of our investments outside of India, I talked about Athena, I talked about Hippocrates. We've done synthetic genomics and genomatica, which are kind of fundamental technology, engineering microbes, for kind of chemical production and stuff like that. And a lot of stuff in the device space, whether it is asthma or neuro space. In an India context, I think the biggest opportunity that I see is really the bottom of the pyramid. If you look at the bottom of the pyramid opportunity, which is not the tier 1 cities in India, $30 billion is spent, by the tier 2 towns and the village folks. But that said, how do you reach them? These are micro transactions. The cost of distribution is going to be expensive, and you definitely have to apply technology. I've come across some very interesting companies. I mean, take example of HMRI. I don't know how many people are here from Hyderabad. Today, they receive 50,000 calls on a daily basis, in their call center. And majority of these calls, are from people, and these, kind of diseases could be diagnosed on the phone, and then, some medicines, over-the-counter medicines could be prescribed. So you build a knowledge base, and you are serving majority of these guys. And you look at majority of the problems that are caused, in a kind of a rural setting. They're all very much water related. And Nandi, which is based out of Hyderabad, has been a pioneer. If you look at, they have delivered safe drinking water to 3 million people out there already. Simple reverse osmosis plants, that are set up in these rural villages that deliver water, clean drinking water. So clearly, the BOP, the opportunity is, to be able to deliver water and some kind of medical consultation, primary medical consultation. And if you diagnose that to be a big problem, you've got to refer them to a hospital chain, you're not going to treat that. And then dispensing, these medicines, the generics, for many of the common issues are gastroenteritis, malaria, viral fevers. The majority of these are not life-threatening if they're treated properly. So that I see as a huge opportunity. I think, it's just a question of you have to work with government. You have to partner with government. When you have to reach these masses out there, because government has the network and they also have the will to do it. So can you partner with government is the key question. Then the second piece is replicability, the standard operating procedures. How do you build run books so that you can replicate the same thing across all of your facilities? And third piece is technology. How do you apply technology? In the case of one of the companies that I'm looking at currently very actively, they have a local nurse that diagnoses the problems, but at the same time, they're kind of pairing up that nurse with the call center, a central call center where they would have doctors on call with a knowledge base, and also a telemedicine kind of a facility. So clearly I see that as a huge opportunity, in terms of, from an India perspective. And from a technology point of view, the healthcare information systems, medical records management, all of those are opportunities, for technology providers. From an urban setting point of view, I do see, the recovery and the rehabilitation centers. There are, kind of centers between the home and the hospital. After a cardiac surgery, I need to spend the 3 or 5 days, in the hospital, but I don't need to spend the 30 days. But the next 20 days are fairly critical, and a home is not, basically geared up, to provide, that kind of an environment, that wellness kind of an environment. Definitely those rehabilitation, recovery kind of centers, that can scale, are the opportunity areas that at least I kind of see out there. And education and training is a huge opportunity. I mean, clearly, if it is more demand-driven as opposed to supply-driven, you understand the industry requirements and then be able to produce revenue-ready kind of talent, there is a humongous opportunity.
So I think all the areas are there, and I think this the last part, the skill set training, I think is going, because I think if we don't have that, that's going to be the greatest impediment of growth of the industry. It's easy to put up the infrastructure, it's easy to tell people about processes, but if you don't have the right skill sets, it just doesn't work. And we've seen this happen in healthcare over and over again. Then private equity is all about, smart money. So, the money comes with a lot of knowledge attached to it, and actually the private equity player also helps you not only network but scale up. So now I'm going to ask Yash, about his experiences. Once you've actually made an investment, how can you then get the hospital or the healthcare provider you've worked with to actually improve, scale up, and go ahead? Because now you've become a stakeholder in the whole game.
Evolvence works on a model, what we call active partnership model with our client companies. In active partnership model, one of our general partners in the company, in the advisory company, the fund, is a part of the board that advises the company on how to go forward, how to scale up, and actively take part in board meetings and act as an advisory to the company. What are the, as I've told you earlier, the healthcare expertise in the company helps add value to our client companies. Being a board member, the board of director will be actively taking part in setting up corporate governance practices in the company, then during scaling up of let's say in HCG hospital that we've invested. Manish is part of HCG, so yeah, he's in one of the client companies. When we invested in the company in the hospital, it had about 4 to 5 centers. Right now they've scaled up to about 13 centers. So either in corporate governance, in talent acquisition, or in business development. When we invest in pharma companies, we would like them to get more clients from big pharma companies abroad. What we do is we connect with the big pharma companies to get clients for our investee companies. That's one of the ways we add value to our client companies.
So I think the smart money concept really works because you not only use your network, but with them help them through the expansion, tell them how to go ahead. And I think maybe at a later stage, once it matures, also look at how do you increase the bottom line over a period of time, because you're both stakeholders in that. I'll now come to Vikram, and you have a large fund, but you waited a long time before investments. So what were the sort of challenges? What were things you're looking at? What were things you came across and you probably left and said, this doesn't suit us, there's a problem with this. So some of those practical experiences, if you can share with the group.
Yeah, Rana, you had there on your slides, one of the slides where you talked about the typical challenges. And of course, a healthcare fund like ours will obviously be having the same kind of challenges. And typically a private equity fund, when they look at any investment, the various issues that they face. One is you have to look at the size of investment. Typically if you're a big size fund, if you're a 400, 500 crore fund, you're looking at an average deal size of about 40 to 50 to 60 crore. And when you're looking at that kind of size, and if you're looking at a minority stake, you're looking at a company which is at least valued at about 100 crores. So, if you look at the entire space, how many companies are there with that kind of size. So that actually brings you to the point where if you understand the sector, and can you look at various different business models where you can consolidate things, that the entire healthcare life sciences space, there are various possibilities to integrate various business models and create a integrated business model, like hospitals as an example. Yes, there are hospitals, the standalone hospitals are trying to become a network of secondary, tertiary care or primary care hospitals. But there are other possibilities. For example, a hospital network could also become an SMO, like a site maintenance organization. Or typically because a hospital network is, there are various examples in the US and the developed countries where these networks would also be running a CR on the side so that, they have an integrated business model. And in India, there are lots of groups which are coming up with, offering other things like having a nursing college, having various other, even stem cell research as part of their overall network. So when we look at from private equity angle, we want to look at the size. So size is one of the very important criteria. The second thing we look at is the scalability potential. So when we actually make an investment, we look at, we have an exit in mind. So typically exit is anywhere between 3 to 5 year kind of time frame. And can we reach a size where our investment becomes a 2x or a 3x or more than that in that time frame? When looking at that kind of scalability, you have to really see that your business had that potential to really grow up. So that becomes a very critical aspect. The exit becomes very important. So that's where, as Yash mentioned, that, you have to be part of the overall growth process. You have to make sure that you continuously, guiding the promoters in terms of how you could actually take them to the next level. So these become very, very important. And to answer your first question, which you said in terms of, yes, we took a lot of time before actually starting to make our investments. And typically, and that's how, fundamentally we believe that it's not just about going ahead and start making investments. It's about preparing yourself, prepare a solid ground for yourself, and make sure that what you're doing is fundamentally going to make a difference. That's how we believe that we mapped out the entire space fairly well. The kind of research we've done is phenomenal. And we believe that we are at a point in time where, the kind of deals that we're looking at right now, we believe that they're in terms of, deals fitting those criteria, in terms of the size criteria, in terms of the growth criteria, the exit potential, the kind of promoters we're looking at. So we believe that a fairly good number of opportunities, despite we keep talking about all these challenges, but we've been, quite surprised by the fact that, despite all those things, the private equity opportunity in the landscape is now coming to a point where it's very uniquely positioned, and we believe that we are very uniquely positioned in that space to really capture that value.
Thank you. So we can see a lot of new investments from them, and I think, like you said, uniquely poised. So probably over the next few years, we'll be hearing a lot of them in the news.